The body needs a constant supply of oxygen to allow vital organs to function properly. Oxygen intake is managed by the respiratory system, which is comprised of the airway and lungs. The body's circulatory system, which includes the heart and blood vessels, functions to transport oxygen to every cell in the body. If the heart stops functioning, this is called cardiac arrest and initiate CPR immediately. If the person is gasping or not breathing adequately, initiate adult CPR for cardiac arrest. Cardiac arrest occurs when a person is not breathing and has no signs of blood circulation. This means that the heart has stopped pumping blood throughout the body. CPR, or cardiopulmonary resuscitation, is a technique that helps to circulate oxygenated blood throughout the body and delays permanent organ damage. CPR involves two separate components, chest compressions and breaths. When doing chest compressions, you push the blood in and out of the heart, circulating it around the body. When giving breaths, you are providing the casualty with oxygen. When you alternate between chest compressions and breaths, you are performing CPR and you are helping to keep the person alive. To do CPR, place the casualty face up on a hard surface. Place the heel of your hand in the center of the casualty's chest, between the chest muscles, straight across from their armpit. Give 30 compressions at least 2 inches deep. Compressions will force the blood out of the heart and circulate it around the body. Allow complete recoil of the chest between compressions. Push hard enough to achieve an appropriate depth. Go at a rate of at least 100 compressions per minute. Minimize any pauses or interruptions when giving compressions. Open the airway and give 2 breaths. Open the airway using the head tilt, chin lift method.
Tilting the head back and lifting the chin will move the tongue away from the back of the throat and allow an open airway.
Let's take a look at that on a model. Give 2 slow breaths to oxygenate the blood now. When giving 2 slow breaths, keep the airway open. Seal the nose shut. Place your mouth around the person's mouth with a tight seal. Each breath should be given over 1 second with sufficient volume to achieve visible chest rise. Use a breathing barrier when possible. Avoid excessive or quick ventilations, as this may cause the person to vomit. Repeat cycles of 30 compressions and 2 breaths. CPR circulates and oxygenates the blood. It helps to keep the brain and vital organs alive. Keep your arms at a 90-degree angle to the body. Keep your elbows locked. Make sure your arms are straight up and down. If you feel the ribs break, keep going. In cases of sudden cardiac arrest, the oxygen in the victim's blood is still high. Therefore, chest compressions are the most important part of CPR. In the case of respiratory-related causes of arrest, the breaths are now important. The current recommendation for CPR includes compressions with breaths, as it fulfills a more universal role in dealing with both cardiac and respiratory-related causes of death. Continue CPR until emergency medical personnel arrive and take over. You are too exhausted to continue. Signs of life return: spontaneous coughing, breathing, or movement. The area becomes dangerous. An AED arrives.